among the highlights, the Republican plan does away with the individual and employer mandates from Obamacare, but it keeps coverage for people with pre-existing conditions. It maintains the ban on lifetime coverage caps and lets young people remain on their parents' insurance until the age of 26. It also promotes continuous coverage. It eliminates the Obamacare mandate, but it promotes continuous coverage by requiring a 30% premium to the insurance premium on people who let their insurance lapse. It rolls back Medicaid expansion for low-income people that provided coverage for 10 million people across 31 states, but provides tax credits to help people pay for insurance based on age, not income, although the wealthy would be excluded from those credits. The tax credits proposed would start at $2,000 a year for somebody under the age of 30. So if you're 20 years old and you have income against which you can claim these tax credits, you can probably buy insurance for $2,000. The credits, however, would rise to a maximum of $4,000 for a person age 60 or older, which is likely not enough to buy anything better than catastrophic insurance. So we've got all this covered with our team of correspondents and special guests. We begin with NBC's Chris Jansing at the White House. Chris, let's start with you. The president heralded this plan this morning on Twitter. There are a lot of questions about the cost. In fact, we just heard Casey Hunt asking asking whether more people will be covered or fewer. We don't really have full answers on that.
Yeah, and that's really the critical question here for a lot of folks who are out there in Congress, because they can't go back to their districts where people have gained health coverage. They're among the millions who have gotten health coverage, and say it's going to go away. So that's the immediate problem. When you look at the House side, we talked to Jim Jordan, a member of the House Freedom Caucus. We asked his spokesman about whether or not he would support it. The answer we got, he doesn't see that as different from the draft plan that was leaked a while back, and he didn't like that plan. They're going to need every Republican on the House side, so that's why they're trying to make this sell. Over on the Senate side, you have this letter from 4 different Republican senators to talk about whether or not people are going to be covered, questioning whether or not they're going to be able to go back again to their districts and make the argument that their health care is okay. They wrote to Mitch McConnell, quote, "The February 10th draft proposal does not meet the test of stability for individuals currently enrolled in the program." And OMB Director Mick Mulvaney, who was sent out by the White House today, was asked about coverage on the Today Show, and here's what he said.
Under Obamacare, we forced people to have insurance. It's a real easy way to make sure everybody has insurance, right? When you put a mandate on it and they don't participate in the process, when you take government and put them between people and their care. The program that we've talked about today that the House rolled out last night is a program that puts people in charge of their own coverage, and they can go out and get that access through the safety nets and the other things that we are providing.
The actual answer to the question of how many people will be covered was, the real answer is, Mulvaney said, compared to what? And then he was also asked about the price tag, and he said, we will know what it costs before they vote on it. In fact, those 2 committees represented there, Allie, both are going to be looking at this tomorrow without that number, the estimate from the Congressional Budget Office. One more thing I would say, this afternoon, some of those Republicans are going to be coming over here to the White House to talk to the president. Surely one of the key things here is going to be strategy, since they have so much pushback on both sides, the House and the Senate.
Right.